Hi everyone, my name is Deniz Aktan. I'm a clinical child psychologist in Turkey, and at the same time, I'm ISST-accredited Schema Therapist, Supervisor, and Trainer. And today, I'm going to concentrate on Schema Coaching as a therapeutic intervention method when we work with children, adolescents, and with their family. If you like, before I introduce this schema coaching technique, I'd like to say a few words about what makes it so special. When we look at therapies for children and adolescents, we see that even when the primary focus is the child, they also pay attention to the families. These approaches typically intervene in the child is presenting problems while considering that the family may be a risk factor, and they use psychoeducational method to bring parents into the process. But this is where schema coaching really stands out. In schema coaching, we put the parent at the center just as much as the child. And we move further and include parent-focused intervention as much as basic psychoeducation sessions. Because we pay attention to the parent's own triggers in the parent-child relationship, we address not only how the parent relates to their child, but also the parent's relationship with their own parents and how those early relationships show up in how they relate to their child today. So, how do we do all of this? In today's talk, I'll walk you through step by step how schema coaching help us to achieve these goals. When we begin working with schema coaching, our very first goal is to explore the family dynamics. Therefore, we use Schema Genogram Technique, and this is one of the most important tools we use for this purpose. By using this technique, we start to uncover the parents' relationship with their own parents, and we also asking some key questions in this part. Maybe the question should be like this. How does a parent's family history affect the way they relate to their child today? And another question is, how do the schemas that were reinforced in the parent's own childhood shape their current parenting? And is there a possibility of intergenerational transmission of schemas? In the schema genogram technique, we search for answers to all of these questions while mapping out family members in a way that resembles a family tree. However, we are not only examining who is part of the family, we also try to discover the closeness, conflicts, and patterns of interaction among them. This allows us to gain insight not only into the child's schemas and modes, but also into the schemas, modes, coping styles, and behaviors of other family members. And from there, we can reflect on how all of these influences the parent-child relationship today. As you can see in the figure, while we work on exploring family ties through this exercise, we also include some guiding questions for the parent to answer. For example, what was your father or mother's parenting style? And another key question is, how do you feel about your family today? What aspects of your parents made you feel good and what made you feel bad? And the other important question is, which issues were hard for you to agree on with your own parents? Are there others you struggle with on these issues? And one of the most important one is, are these issues similar to the ones you struggle with your own child? By reflecting on the responses, we begin to uncover how the parent's relationship with their child today has been shaped by previous generations. And at the same time, we aim to increase the parents' awareness of these intergenerational patterns continue to influence their parenting. Moving on the next step, after we've truly analyzed both past and present family dynamics, we bring our focus back to the here and now. And at this stage, To clarify the crisis between the mother and child, we examine the triggers experienced by both parent and the child in this conflict situation. We ask some key questions in this period. The question should be like this. Could the conflicts between my child and me be influenced by unmet needs from my own childhood? And the another important question is it possible that the unmet needs are primarily my own needs and that I might be projecting or confusing them with my child's needs? To shed light on these important questions, we use the case conceptualization set to analyze the crisis in depth. Here, I'll walk you through an example case focusing on how a possible triggering process might unfold in a conflict between mother and child. Let's say the child in our case is named Ali, and Ali is around 12 years old and in middle school, and he has an important exam tomorrow. But today, on this day, Ali's playful mode takes over, and instead of studying for his exam, he prefers to play games on his tablet. And now this becomes a major trigger for his mother. But why? Because she was raised by parents who were highly critical, demanding, and who believed that success was the most important measure of worth. Growing up in that environment has reinforced her own failure schemas. As a result, she tends to view every experience through the lens of success or failure, even her experience of being a mother. So, if her child doesn't study, she believes he will get poor grades, and if he get poor grades, she sees herself as a bad mother who failed to raise him well. And in reality, she is still trying to meet her own parents' expectation of what it means to be a good mother. So, how does the crisis actually begin? Let's start with the first step. In the first step, the mother notices that her active and playful child is spending time on the tablet. This triggers her vulnerable child mode, and she starts thinking, oh my gosh, I can't get this right either. If he doesn't study and get good grades, how can I be a good mother? I always fail at everything. And in the second step, the triggered and crying vulnerable child awakens the dysfunctional angry parent mode. And in the third step, this mode takes over and scolds the child and pressures him to study in a dysfunctional way and say that, hey, if you keep going like this, you'll never be a successful boy. Go back to your studies right now. And in the first step, Ali is confronted with his mother's angry side. This triggers his own vulnerable child. And along with the emotional deprivation schemas, his vulnerable child mode awakens. The vulnerable child begins to cry and thinking, my mom doesn't love me, she doesn't understand me, she doesn't see my needs. In the fifth step, Ali's crying vulnerable child activates his angry child mode. To protect the hurt Ali and vulnerable Ali, this mode lashes out as his mother. You are such a bad mom. You are such a bad mom. I hate you. I wish you weren't my mom. And in the next step, Ali's angry child mode once again triggers his mother. And this time, the dysfunctional parent mode comes back even stronger, more punitive and more furious. She yells at him and says that, shut up, put that down right now and start studying immediately, or I'll punish you. This, of course, escalates the crisis even further. And the case conceptualization technique helps us clearly see why the mother is being triggered, why she turns to a dysfunctional parent mode instead of her health parent mode, and what unmet needs she carries from her own childhood, and how her early experiences continue to shape her behavior today. To shed light on all of these questions, the next step is to look more deeply at the dynamics that have been passed down from past generation to the present. And one of the most important techniques for this purpose is the house of the generation. Before we begin to house of the generation technique, we use an activity to review the parents' positive schemas in order to strengthen their investment in the healthy parent mode. The purpose of this activity is to begin reinforcing the resources of the healthy parent mode. So, in practice, this means having a conversation with parents about 18 positive schemas and exploring how they access and use these resources. Once this foundation is in place, we then move on to the house of the generation technique. The house of the generation technique allows us to explore how a dysfunctional schema passed down from previous generations affects a parent's current experience with their child. In other words, it helps us focus on past experience that activates the parent's dysfunctional parent mode. Once the parent gains the awareness, we begin the work using the positive schemas we previously identified. With the support of the healthy parent mode, which is fueled by these positive schemas, the parent can start to experience how the problem can be addressed differently. In this way, parents not only see how past schemas continue to trigger the present, but also get to practice managing these triggers using their healthy parent mode. As you can see in the model, the skin at the top level represents a challenging or problematic situation that the family is currently experiencing in the present moment. In this stage, we take a closer look at the schemas that are activated as the family goes through this difficulty. At the bottom level, we explore the origins of these dysfunctional schemas, specifically from which generation they have been passed down. Here, the family is invited to recall and describe whatever memories they have related to intergenerational transmission. For instance, in this part, we may ask some questions like, who might have similar schemas in the family? What was the first situation where these schemas were triggered? The answers to these questions help us see how these patterns have been passed down through generations. Once we have reviewed the similarities between the past and the present, our focus moves to the middle level, which represents the parental resources. This level includes each of the 18 positive schema resources we work with in the positive schema training. These resources serve as the nurturing elements of the healthy parent mode. At this stage, we then rehearse how these healthy and positive schemas can step in to stop or soothe the maladaptive schemas that have been triggered in the current situation. Essentially, we ask, what does the parent need in this triggering moment, and how can the positive schemas support and guide them? Through this process, the parent learns to activate their health modes more consciously and to respond with greater emotional balance and compassion both toward themselves and their child. Another key step in parent schema coaching is limiting the dysfunctional parent mode. In order to limit dysfunctional parent mode, parent-focused chair work is very important. Through this technique, the parent can first experience caring for their own vulnerable child, that is initially triggered in their interaction with their child. At the same time, it supports strengthening the healthy parent mode to limit the dysfunctional mode that is activated when the vulnerable child is triggered. And another important goal of schema coaching is to use imagination technique, so that parents can mentally experience what happens when the healthy parent mode is activated during crisis with their child. This allows parents to feel just how special and hopeful it is when their healthy mode is in play. In turn, instead of reacting as a wounded parent triggered by a dysfunctional mode, they get to practice how the crisis can be resolved when the healthy parent mode steps in. So, the question is, why do we do all of this? Because we know that there is no winner in parent-child conflicts. And therefore, it is equally important to strengthen the parent's health-to-parent mode through these techniques, just as the child is clever's mind-wise mode. To summarize my presentation today, we can say that when working with children and adolescents using schema therapy techniques, schema coaching is one of the key methods that can be applied to actively involve parents in the therapeutic process. Moreover, by positioning the parent at the center of the process, schema coaching demonstrates that it includes not only psychoeducational intervention, but also parent-focused coaching interventions. This distinctive feature sets it apart from other therapeutic approaches. Thank you for taking the time to listen to my presentation and for contributing to the recognition of schema therapy techniques focused on children, adolescents, and families. Have a good day.